and share some of the concerns that I've had as a physician, and to discuss them with your audience. And I was asked to address restoring health in times like these. I am trained as an obstetrician gynecologist, and I have a subspecialty in maternal fetal medicine. This is high risk pregnancy. And while pregnancy certainly is part of the concern with the corona outbreak, it is only a small part of that concern. I've been in practice for 40 years plus and been in Milwaukee for 35 years. And until the beginning of this year, none of us probably had thought much about viruses and pandemics.
Yeah.
And so now we know about the COVID-19 or coronavirus 2019. And I became very concerned because I recognized that this was going to be a problem for African Americans, even though we were receiving reports that there was no greater concern for African Americans than there were for any other person. Anybody was at risk of becoming infected, becoming ill, and possibly dying. But if you think about most medical conditions, we've learned that we as African Americans tend to be more likely to be the sickest of those individuals. Not that there's anything inherently wrong with us or defective about us, but as we've come to learn, there are a number of other factors that contribute to our manifestation of various illnesses. But having said that, my concern is that I would expect, if this is any different than any other condition, that we would be at greater risk, and began to raise this concern with others that I had about the risk of dying as a result of this particular virus. And certainly we've come to learn that as time has gone on, as we've looked at some of the data coming out from various parts of the country, some places worse than others. And unfortunately, or fortunately, I've had some experience practicing in various parts of the country. And so it makes it a little easier to visualize the population of people and understand why in places like New York or Chicago, you've had probably more of your deaths because those places tend to be more highly populated and people are living in closer proximity to one another. And so the risk of infection becomes greater under those circumstances. I am sure that you are aware, as we have, that if you look at the state of Wisconsin, which has about 6% of its population African American, and in the city of Milwaukee, about 35% of that population in Milwaukee consists of African Americans. And what we began to see is that there were greater numbers of Milwaukee residents not only becoming sick, but also among those that died of the condition. and are dying of the condition. So this has made me particularly concerned as to what it is that's available. What is it that we can do so that we may survive this real tragedy?
Mhm.
And I think that we've gotten a little bit away from those issues as we begin to look at some of the political aspects that have been raised from the standpoint of who makes the guidelines as to what people can do and cannot do, and the discussions about whether businesses are to stay open or closed. And let's not get beyond the fact that we are talking about that which has the ability to result in the loss of many lives, which we have already uh, being advised of. We're seeing that there is much less um, that people think can be done. There's no treatment that is presently available. People are speaking about creating vaccinations, which traditionally takes a great deal of time as a result of study, determine what can be done to treat those particular infections. So we don't have a treatment, but we know that this is an infection that's highly contagious, meaning that people can become infected and become ill. And there's some experience that can be gathered from that which has been learned in those countries that seem to have been affected earlier than we were. China has been mentioned, Italy, but in all countries at this point, there has been someone who has been infected, and as a result, there have been a number of persons who have died. Concern is that people are educated, that they understand that which has been known, what's being shared. And what we know is that those individuals who are older seem to be among those who are among the fatalities, those who have died, people who have had hypertension, diabetes, those who have cancer or who have survived cancer, who are HIV positive or kidney dialysis, those who are smokers, who are alcoholic, or who are drug users. And with just that list, we can certainly find many that we know that fit into that criteria, although um, this is not the only group of people. We're seeing even some young children, some people who do not have any of these conditions that I'm mentioning, who have been among those who have become ill, and for those who've not been able to fight those infections and survive. Because again, there is no treatment at this point for this virus. Here in Wisconsin, we've talked and heard mention of safer at home. And safer at home is primarily is referring to a self quarantine where you have been asked to remain in your own space with the idea that you are going to be less likely to become infected or infect others. You're going to be less likely to be around items or places where this infection may live. And this is also, though, a challenge because we have an immune system, which is part of all of us, the ability to fight any type of illness. And so we are naturally designed to fight that which any enemy that attempts to attack us. The quarantine, I think, has been uh, emotionally traumatic because we are used to doing what we want to do and when we want to do it. But this is a time that we have asked to do that in our own home, in our own space, and remaining around our own families, not going into our jobs where there may be those who are infected and increasing our risk of exposure to this virus. Um, One of the things that hasn't been said that I think is worth considering is that when we speak about being quarantined and being in a space with our families, we are not taking into consideration that some of those family members may, in fact, be infected but may not be ill. But the fact that they are infected, they are at risk of exposing us to this virus that may, for some members in the family, result in their deaths. And so we have not really had a means of testing everybody in the house to know if we're safe to be around the people in our own homes. And we have certainly heard reports of several members of the family becoming ill, some dying, and others being only minimally ill. And so it may be, or one of the things that we perhaps should have been advised of the need of separating ourselves from family members within our own homes. And maybe masks were necessary, not only the hand washing and the use of antiseptic agents, so that we were not going to be, or at least less likely to be infected by our own family members. But certainly those of us who've had family members who've worked in areas where there were large concentrations of people, those who've worked in hospitals and nursing homes. Unfortunately, we've received a lot of bad information. And I think, unfortunately, people were being asked to speak to things that they really didn't know a whole bunch about. And so, certainly early on, there are many of us who may have gone to a hospital and reported that we were experiencing some of the symptoms that were listed and were told to go home, that we didn't need to be tested and we didn't need to be evaluated. And that has really contributed greatly to a lot of disappointment when we learned that some of those people who've been given that kind of information then suffered a death following that. And unfortunately, much of that information was because people were uh, saving the testing material. And they decided that they're going to save it at our expense. And so it goes back to some of the things that we've always faced, where we were not always being given the best information, even though we may have known better, or the health professionals knew better. we are still not in a position that we can adequately protect the citizens. We are still lacking proper uh, personal protective equipment, the masks, gloves, antiseptic, which is not only a problem for the professionals within the hospitals where that equipment is being rationed, but it is still limited availability to the communities. The social isolation is a factor that is also often not really considered, but I raise this where we have people who are in their homes by themselves, who may be ill, and there's no one to check on them. And so this is something that I would remind people to begin to do, is certainly check on family and friends. And we now have some of the technology that allows us to look at them and to see how they're looking, but also encouraging those who might not be otherwise inclined to go to the hospital to do so, despite being told not to go to the hospital. So I would make that point very clear as well. If you're not feeling well, you need to be assessed by a health professional to determine if what you're experiencing could be serious and warrant closer observation, or could you do well with some supportive measures? So having a fever and just going home and taking Tylenol may not be sufficient. I'm concerned about the isolation from a spiritual standpoint. We've closed our churches, which for many African Americans has been a very important part of our existence, our faith system, which people have attempted to do some other things, making use of the social media, making sure that we're doing things as we're doing now. But there's still something that's lacking in that. And so I am concerned that we do not have available to us the resources that we've been accustomed to rely on our faith, that we can survive this set of circumstances that we're facing. I'm looking at this experience, though, as not being all bad. And in some respects, I think that we need to look at this as a blessing in many ways. I can certainly say, in my own experience, it has forced me to do some of the things from a health standpoint that I always should have done. We've got a reason to rest, to sleep. And this is all very important for boosting the immune system. The sleep is critical. Getting water, taking the time to do that. Many of us have gone the whole day without having any fluids. This is certainly not a good thing, even for people who are basically healthy individuals. It has allowed us some time to concentrate on our food selection, which also can be helpful for boosting the immune system. And taking some time to getting some exercise. We're not getting to the gym, we're not getting to the pool, but we are doing some things better than we would ordinarily do it. And then it has given us a time to listen to our body. The body is beautiful. It tells us many things. It may not give us and report a diagnosis, but it allows us this time that we've had in our quiet and rested mode to listen to some of the signals that our body is giving to us. And so we need to pay attention to those messages that our body is naturally giving us. And the last thing I wanted to mention, which I don't see having been addressed, and I hope that we can begin to do that, is what I refer to as a virtual hospital visit. To have people in the hospitals who are not with family or friends to visit them is truly a concern. It is a concern for the healing of those who are hospitalized, and those individuals may feel very isolated and feel that they not only do they feel as though they are dying, but there's no one to tell them otherwise. And they are hospitalized with people who they don't often trust, no matter how nice those individuals may seem. That doesn't mean that the patients, African American patients who've had some not so pleasant experiences, may not trust that information. And so then they have no family and friends to tell them otherwise. And so I think it's extremely important for us to look at a means with the technology that we have to allow for that patient to see and be seen by family and friends, and so that they are not feeling alone and being left to die. And so I would encourage us to pursue that measure moving forward. And we must demand of those individuals who are in those positions to represent us to make sure that there is ample personal protective equipment, masks, gloves, antiseptics available to our healthcare workers, as well as I'm going to end there, and I'm so delighted that you have invited others of us to meet with you today and to discuss some of the other aspects in greater detail that I hope that you take to heart and can use this so that you are not among those that don't make it, that you are not among those statistics, but that you either are not infected or do not become ill. Thank you.
Thank you, Dr. James. Does anyone have that experience with someone being in the hospital and you felt isolated?
Well, hello, good afternoon. Well, evening, everybody. Just to introduce myself, is everybody hearing me?
Looks like everyone.
You guys hear me? To introduce myself, I'm a psychiatrist. I do general psychiatry, which is adults, and I have a subspecialty in child and adolescent psychiatry. So I am currently employed at the Behavioral Health Division, which is the old Milwaukee County Mental Health, as we all mostly know it. I've been there about 18 months. I decided I wanted to be here in this community. I've been searching for work, but I've worked for many organizations. I've worked for St. Charles, which deals with children's issues, AJA, which had day treatment and shelters. I worked at Aurora Psychiatric Hospital for some time, and I've even worked with the Oneida Tribe and then in Fond du Lac County. So I got to experience a lot that's going on here in the state of Wisconsin as far as different populations. Milwaukee's my hometown. I was born in Chicago, but I came here when I was first grade. So this is my hometown, and I came back some time ago. So thank you for inviting me. I decided I did not have a PowerPoint presentation. I actually am just going to speak. but you can reference NAMI, which is a National Alliance of Mental Health. And I'm using this fact sheet, their bullets, as my points of conversation today. And it's called African American Community Mental Health. So it's from NAMI, AMA. My apologies. I had looked at two. I thought this one was better. All right. So African Americans in the United States are less likely to receive an accurate diagnosis than their Caucasian counterparts. Schizophrenia, for instance, tends to be overdiagnosed in the African American population. I experienced that here in Milwaukee with a program called CORES, which deals with early onset psychoses. I mean, it's a good program in that people need to be captured early. It's just that sometimes the diagnosis of schizophrenia or schizoaffective, I think, comes too soon, and approaches how they're treated as far as medications. Cultural biases against mental health professionals and healthcare professionals in general prevent many African Americans from accessing. So I often hear people, oh, I want a Black psychiatrist, or I want a Black psychologist, or I want a Black therapist. The fact of the matter is that only 2% of psychiatrists are African American, or I'll just say of African heritage. I might be expanding it by saying that 2% psychologists of the total. 4% of the social workers in the United States are African American. Now we're 12% of the population, so we're really at least 10% behind in these, if we're going to set these as goals. So there is a risk of historical misdiagnosis and inadequate treatment, and sometimes harsher, more punitive approaches, especially in children with child protective services, and with our young people with the police. African Americans tend to rely on family, religious, and community, like social outlets for their emotional support instead of turning to healthcare professionals. And there's a benefit to having that as part of their repertoire, but they tend to stay away from mental health or the healthcare system when they're dealing with these issues of mental illness or concerning behaviors within their families. Mental illness is frequently stigmatized and misunderstood in the African American community, and they're much more likely to go to their primary care doctors, which is something I always often pitch when I get to talk to primary care doctors. And many of you will know that means your family doctors, your internist, pediatrician, OBGYN. They used to argue that they weren't primary care, but they absolutely are. Sometimes that's the only doctor women will go see. But they're frontline. And if they are limited with time or sensitivity or cultural, I'm going to be bold and just say incompetence or lack of competence and being able to read things and ask important questions, people are missed. And studies have shown that when people have completed suicide, a large percentage of them had been to see a primary care provider within the past month or gone to the emergency room, but the questions weren't asked. Mental illness is frequently stigmatized, that's the one I read. African Americans are often at a socioeconomic disadvantage in terms of accessing both medical and mental health care. And in 2006, and so this is an old statistics, only 1/3 of working adult African Americans were insured the year prior. Now, when we get people willing to go through Badger Care and those kind of options, it improves. It's just getting a lot, and especially our young men who are unemployed to seek health care. They tend to get health care when there's a crisis or when they get into the system, be it criminal justice system or juvenile justice system. Usually our children will be covered though, but our young adults often aren't. Even when I worked with the young people of Job Corps, they were covered health-wise while they were in Job Corps, but if they needed medications and it had to do with mental illness, oftentimes they would recommend that they would leave on a medical leave. So then they'd be gone for 6 months, supposedly to get treatment, where, in my opinion, the opportunity to receive treatment was right there and we let them slip through our hands. But there were a lot of debates about, well, if he can't make it without medicine, he wasn't going to make it anyway, which is a big fight. Strongly disagree because many people have major depression get treatment in a very functional society. So, so across a 15-year span, suicide rates, we used to say Black people didn't kill themselves. Well, that's no longer true. I don't know if it was ever completely true, but our rates have increased 233% amongst African Americans from ages 10 to 14, compared to 120% amongst our Caucasian Americans in the same age group in the same span of time. And so in my time working with the county, and I've been there about 18 months, and I've been doing psychiatry for 23 years. I've experienced my first patient who was killed by homicide, the first one who was, now these are like my Latino or Hispanic males, one who completed suicide, but he was high on something, and another one who committed murder, and he was psychotic. I hadn't had any of those scenarios until I've been with Milwaukee County. And I think that's pretty eye-opening for me. So, somatization. This is another thing that might be getting minimized when Dr. James mentioned how people go to the emergency room or to the doctor with symptoms and people will send them home, because there is a pattern of African Americans to have more somatization in their illness. But I also find that true in my people of color. I've worked on the Navajo Reservation and the Oneida Reservation and in the Virgin Islands, and then with my Hispanic population, much more somatic, so much more of mind and body being tied together in their expression of illness. And so somatization they note it occurs at a rate of 15% amongst African Americans versus 9% in Caucasian Americans. And so when they come to the primary care providers to ask that additional question, which that 10 to 15 minute limitation you have makes a challenge for you, but to ask the next question and then the next question. So, and for us to be more aware of kind of like roots of some of the illnesses like chronic headaches and stomach aches consistent with anxiety disorders. Also with depression, our immune systems are decreased. 25% of people who get diabetes have a risk of getting depression. And so it's tied together. And I found that true of my Black and brown communities. Some studies suggest that African Americans metabolize some medications more slowly than Caucasian Americans. Now, on the other hand, some Caucasians are fast metabolizers. So if you're a slow metabolizer, that means your dose may need to be lowered or you're going to have more side effects. And if you have more side effects, let's make it a 20-year-old male who I give an antipsychotic to, and he has more side effects, it increases the chance that he is not going to stay on those medications. And so they might, however, get higher doses, and they get higher doses. Again, I think that's because of cultural miseducation. A lot of our white counterparts, or even who came here and are practicing medicine, misread or misinterpret the way that especially our African Americans, our young folks communicate. And our passion or intensity or our body language is often read as threatening when it's not. And if you feel you're threatened, then we're going to increase the medications. We're going to contain the situation faster. There are going to be more people there likely putting hands on, and you will get medicated. And I will add to this that some of that intensity has a lot to do with what's coming further down on my list is repeated exposure to violence and trauma, which makes people activated and makes them hypervigilant. The adrenaline levels are higher. They move. They're more pumped. They appear to be more aggressive because they're in the fight and flight mode. And people trying, I'm meaning our law enforcement or in our schools or just in a community, in a crowd, to try to contain that actually amplifies it. People have to learn how to do it. Social circumstances often serve as an indicator for the likelihood of developing mental illness. And most of us know that if you have in poverty, if there's mental illness or substance abuse or use within the family, that there is an increased chance, and exposure to community violence, an increased chance of developing mental illness. This holds true for our children who go into foster care system as well. So we comprise 40% of the homeless population and only 12% of the US population. Nearly half of all prisoners in the United States are African American. So they're in a high stress environment. Children in foster care comprise 45% of public foster care population. It's huge when we're only 12% of the population. Exposure to violence increases the risk of developing mental illness. I've mentioned that again. Over 25% of African American children are exposed to violence and meet criteria for PTSD. But we'll get them called conduct disorder, ADHD, juvenile delinquents, a list of things. And we've worked more in the last, I'd say, 20 years to approach it in a therapeutic way. But all of a sudden, when that 18 rolls around, or 17, there's a whole different way that they're approached. And yes, we're a society, and we all need to kind of be able to all live in the same society and feel some safety. So I understand, like when I'm in the hospital and there's an aggressive kid, I understand that I might need to deal with the fact that I'm going to have to give an order for an injection, and if they can't calm down, then maybe restraints. But the fact is that we have to be able to integrate all these pieces that come into play and try to limit any punitive approaches that we have in mental health, because that contributes to people not coming for services. And so we really have been trying to have people more included in their choices, and children have more rights. At 14, they can disagree and not consent to medications unless we go through courts. So those are efforts to try to make sure that people's rights aren't being violated. But on the perspective of a parent who has had a child back home and they can't manage that child's behavior, and the child refuses meds, and then the parent does the old school way of handling that discipline, then you lose custody or you're getting charged for abuse or neglect. Sometimes it can be quite a vicious cycle. I'm almost done with my bullets. So what we need is to get programs that are respected in our institutions, be it our churches, our community groups, to raise the awareness and the issues and the need for our people to seek more services, so that they can learn that there is a way to reduce the long-term symptoms and adversities of intergenerational trauma and poverty. And so, and then also we need to try encouraging people to seek this field, like even in medicine. I mean, we're getting bigger numbers of nurse practitioners, and it's too bad that this statistic doesn't tell us the percentage of them that are African American. But we need more people in the field to represent our needs and to help our counterparts interpret people's mannerisms and their philosophies and their approaches within their homes and their communities, and to try to normalize some of these things that are seen as pathologic. So those are, I have material, and I don't know how my time is right now. I think I'm right about 14 minutes or so. Am I? Pardon?
Eddie, are you? Yeah.
Okay, because the only thing I was going to share, and I don't need to do it because I can do it later, or not at all. So
you can take another minute, Dr. Nguyen. Take another minute.
Okay, so the other thing I want to share with about me and my experience in the work. First, I have 7 children. I adopted 4 of them from child CPS and their sibling group. And in my household, I had 5 children at some point who received psychotropic medications. And by adopting these children and my childhood experiences, it's kind of given me a perspective that's helped in challenging my counterparts in work. They're interpreting things. But when I speak with my parents in particular, and my adult patients, They're stuck in secrecy and fear and denial. The secrecy is because for fear of the consequences and shame and stigma. But for parents, it's, are you going to take my children? Mm. Another thing that some people deal with their denial is that they will see it as they're like normal hardships of life. And I got through it before, I'll get through it again. You understand? Mm-hmm. Versus that you have had a reoccurring depression since the first birth of your first child. But you resolved it because over time, many people do resolve the depression. And then trauma. It's a huge thing. And I'm concerned with the safer at home because whatever abuse is happening in the homes is likely happening more frequently because close quarters, kids don't get to leave the household, pressure and stress. There's also a lot of conflicts I'm experiencing with the adolescents or the exposure of the grandparents and the grandparents who are raising them to the virus. Mm-hmm. And trying to get these children to understand that even though you don't have symptoms, you have a responsibility, and we are challenged to get our community to understand a collective, that it's not the individual, it's the collective. An individual is not even just your family. It is your neighborhood, it's your community. And that's a task. And even in my house, I have my son sleeping in a tent right now. So he comes and goes as he pleases. He's got a tent with a heater. When he gets a test and it's negative, he can come back in the house. He's 18. And so people think it's really mean, but it's real. His mom is 60. And there's other adults in this house. And so I work in a hospital. My husband works at a jail. My daughter works at a grocery store. There's a lot of risk in our household, and he needs to understand the collective, at least at this address, so maybe he can think beyond that. And I would just challenge that we get our community to take that stance with our young people. Mm-hmm. And that's the end of my questions later.
All right. Thank you, Dr.
Thank you.
Thank you.
Thank you, Dr. Nguyen. And Dr. James. This was a phenomenal presentation by both of you, respectively. How you both, Dr. James, you mentioned that we need to learn about separation within our own homes if a person has been diagnosed with coronavirus, COVID-19. And Dr. James, how you mentioned how we as a community, African Americans and minorities, have received a lot of bad information. Probably the role of racism is within that. I also appreciate, Dr. James, how you mentioned that churches and spiritual entities are not readily available to individuals as they were in the past. And that, Dr. James, how you mentioned that we as a community, as a society, as an African American and minority society, need to demand more of our representatives, especially that our healthcare workers have personal protective equipment, or PPEs. Dr. Nguyen, as well, I really appreciate how you and Dr. James really painted the picture of what it's like for us as African Americans. The historically how there's a risk in foster care for us. How Dr. Nguyen, how you mentioned the increased rates of suicide, 233% versus those between the ages of 10 and 14 versus those of Caucasians in the same time frame and age group. I didn't know, Dr. Nguyen, about the somaticization, how people can manifest physical symptoms of psychiatric or emotional condition or diagnosis. So I really appreciate both of you professionals, Dr. Nguyen and you, Dr. James, kind of just boiling it down and explaining to us all but the problem, because we don't see this, we won't see this on ABC and NBC, we won't see this in the mainstream media, we just won't see it. There's been a couple articles about how, or some news about how African Americans are far more greater impacted by COVID-19 here in the north side, especially in the south side, well, both locations respectively. But I really appreciate both of you, Dr. Nguyen and Dr. James, giving us a very clear picture of what we're facing and how to confront it.
Are we in question and answers period, or is there another presentation?
There's a few more presentations. We have
Brenda.
And then we have Teron Edwards and Dr. Patricia McManus. But this is a period for questions or comments.
We're going to
Thank you,
hold
Dr.
on
Green.
from the questions and comments until the end because we want to make sure we get all our speakers in. So if you could call.
Hello, everybody,
Hello,
Hello,
Brenda.
Brenda.
and thank you for allowing me the opportunity to speak. Okay, I just wanted to say just a little bit about myself, if I can. First of all, I hold a master's degree in social work, where my training as a master's level social worker and psychotherapist has taken me into an array of settings, where I have learned about an array of emotional conditions and treatment for conditions like depression and anxiety. While working with children and their families in schools, homes, and in the community, I currently work for Milwaukee Public Schools as a school social worker, and I'm also a psychotherapist at Sebastian's Family Psychology Practice. In preparation for this presentation that I was so grateful for asking me to present what I know, I have gathered information from my clientele relating specifically to this coronavirus COVID-19 situation. And I have just a brief summary of what I've learned, and I'd like to share that with you. Their fears and their worries and anxiousness are all the overarching concerns that I have learned from my clients. Number one, they mentioned that not knowing, the feelings of loneliness, aloneness, isolation, the not being able to understand conflicting information, who to believe, what to believe, sudden death and dying happening all around, where people are asking themselves that it could happen to them, their children, or anyone. The resource shortages is very real. As we all know, back in March, there were people just hoarding toilet paper, paper towels, water. This was all efforts to survive the unknown. The job situation with furloughs, losses, unemployment compensation, and not to mention all the complications with the unemployment compensation application, where I got so many calls from worry and stress on how they was going to live, how they was going to pay their rent, how were they going to feed their children. They had no money, had no income. Very, 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 very stressful. They also mentioned that they're having concerns with parenting stressors. The children are at home, they're not in school, but they're virtually being educated. And that puts a stressor on the parents because they're not technologically savvy enough to know if the kids are on the internet or if they're on other sites or just really what's going on. Having the parents that are working, they have to go to work, and leaving the kids at home with unsupervised worries, put worries upon them. The children who are non-compliant, who don't follow the rules of discipline and structure, the worry for parents. There's nobody to call to go and check on them because everybody is at home, safe at home. The physical and emotional care for the sick in the home, the elderly in the home. People are afraid to go to the doctor because they may have the virus. They're afraid to go. That's another fear and a worry and anxiousness. A person would sneeze or cough and everybody gets all excited. And you're alienating one person because they sneeze or cough. People who have asthma in the home, seemingly it sounds like they're being isolated in the home because they can't tell the difference between a regular asthma symptom or it could be the virus. So these are just some of the information that I learned from currently from my clientele. And most overarching was the anticipatory grief and loss. The people are questioning their own morality, not say morality, mortality, I would say, that life and death, is real, and it's because it's happening all around them. The anxieties that come from all of this, I guess I can say that through the telehealth modality of being able to reach people by phone, those who have internet access, those who have phone access. I was able to stay in touch, and they so appreciated that, so that I was able to call. They were able to call me. The relief around our food, there are an array of community agencies as well as the food share program has allocated, access to ways to get food so people are not going hungry. So that was I see was a relief for some of the families. The creditors, they tell me that they appreciate the creditors giving them time to pay and taking away the fees. Eviction rules and fees and late fees were modified, so those were some of the relief that the families were telling me that was helpful. So with anxiety, I guess I noticed that families who are clients who had been diagnosed with a chronic mental illness, I saw that their symptoms kind of exacerbated, and I put myself in a position where I was prepared to give them, many coping mechanisms as I could. I saw a lot of PTSD symptoms arise, obsessive compulsive behaviors, adjustment, and of course depression. When I tell my clients that, and they tell me that when you don't feel yourself, just quite yourself, and their usual coping mechanisms like shopping and friends, family, going to church, all these resources have been modified in some way to you, I give them other ways that they can cope. And during periods of long periods of physical symptoms like appetite losses, sleep patterns changes, concentration, overwhelming feeling of sadness and irritability. These are signs where there's maybe clinically depressed, and they really need to see, a mental health professional even above me. I try to not only educate but to inform and make referrals when I see it necessary. So these are just some of the things that I've seen with the COVID-19. And I kind of just see it as a chronic stress for our families. So it's like giving them tools and understanding and education and support, even informal support is better than no support, because the isolation and the anticipatory grief and loss was overwhelmingly something that many of them had mentioned. And knowing people who have been in the hospital for COVID and people have passed away is something that was really, really quite traumatizing to some of my family. So anyway, those are just some of the things that I've seen and I've talked to and I've picked up from my family on anxiety and depression. I need to mention that with adverse childhood experiences that most of my clientele have experienced, again, it's just another level of chronic, long-term stressors for them. We're supporting them in ways that are productive and supportive, and I would say just understanding and talking to them and letting them know that we're all experiencing some of the same symptoms would be very helpful. We'd be very, very helpful for our families. So that's pretty much the end of my presentation.
Okay, well, thank you, Brenda, for that good information.
Eddie, if I could just ask, we want to stay in touch with everybody that is on the Zoom today. So some of you, we don't have your full name, but it would be great maybe if you could put your name in there and your phone number or email, and also like us on Facebook, and then you can also join the Facebook group Center for Leadership African Women's Wellness.
And also check out our website, claww.org, for more information about who we are and what we do.
I will put that in the chat. claww.org.
And so next we have, is it Tehran Edward up next, representing the Rites of Passage, Ascentu Rites of Passage. Hi, Tehran. Unmute yourself.
Okay. Can everybody hear me?
Yes.
Okay. You can hear me. Let's see some thumbs up. You can hear me. Well, thank you all for having me here. Thank you for allowing me to be a part of this. Yeah, my name is Kwojo Tehran Edwards. Kwojo just means, male child born on Monday. I'm the peacemaker, by my cosmic name. I am a facilitator. I'm a teacher. I'm a mentor. I'm a fatherhood advocate. I started a fatherhood movement, Fathers Making Progress. I'm a husband. I'm a father. I'm a trained ritualist. But yeah, I just want to talk a little bit about, the rites, and what the rites are, my journey through the rites, and I guess kind of how we've used it, here and in the community, through this kind of tough time. So I'll just back up a little bit and just talk about, what the rites are and what the rites are meant to do. I've heard a lot of different definitions for rites of passage. So just to kind of back it up a little bit, I'll just talk a little bit about what I'm talking about. So just by this definition, a rites of passage is, an educational process, classes, movements, rituals through which a person in a group or groups of people, are assisted to go from one state of existence to another state of existence in their life. So, we're just talking about a transformational process. It can accompany, any different social position, any age. The Sentu model, that I'm talking about, we got from Dr. Mensah, is intensive and comprehensive model, that emphasizes spiritual growth, and it's a focus on self-discovery. It's not just for men. It's not just for women. In fact, some of the classes, most of the classes are co-ed, and they usually teach with a male and woman teacher, just to kind of represent the spiritual duality. Also, it's not just for young people. In fact, most of the classes that I've seen are for adults. So there are lots of, premises in African philosophy. A lot of, what we learn is derived, comes from, West Africa, where a lot of us kind of originate from, those of us African Americans in this country who were brought here in bondage. So, there are some basic commonalities in African philosophy in existence. Some of them are, for example, that we're all one people, and that our destinies are linked. Most importantly to this, that every person was born, with a purpose and born to succeed. So the teachings come from that center of understanding. It's slightly different, with the youth. I'll talk about my experience with youth later, but for adults, it's about discovering and learning to work with your spiritual energies, to cover, to carry out your purposes in life, with in safety and without fear. There's some of us in this community, we talk about the need, like Sister Wynn touched on a lot of it, Dr. Wynn, so I won't talk too much, but basically the rise of mental illness and pain and trauma in our communities, we're all too, painfully aware of a serious problem in our community that existed way before this COVID-19. That's the problem of arrested development, arrested development in our children, our adolescents, and, in us as a whole, men, women who are living kind of beside themselves, just social, just frankly, outside their purpose. It's 40-year-olds out there, still looking to be young and free. There's many schools of psychology. I just think of Carl Jung and some others who talk about bringing individuals, to that light, to the true nature of being, and, helping them to discover his or her own self and integrate it into their consciousness. So that's kind of how the experts do it, but what this means for us is, in this teaching, we work to try to bring light to people who are like in the wind, as they say. And just as many of us are, struggling to find and bring purpose to our lives. It's people going through life, just continuously asking as they go from one stage of development to the next. And the rights we learn is 7 stages. Some of my teachers say 8. But from as people go from one stage to the next of development, they're asking those questions like, why am I here? Like, why am I doing this? What does this even mean? Even though some of us seem to have it figured out, it seemed like, our lives might be going well, but even those of us who might be quote unquote successful, still at times, we're still asking those questions. What is my life supposed to be about? So the Sentu Rites of Passage process is a process of self-discovery, process of enlightenment. It's meant to help answer these 3 fundamental questions. that, well, I think they're the most important questions in anybody's life. And that's, who am I? What's the meaning to my existence? And just by definition, how does this play out? Like, how do I know this to be true? So when you go through the courses, I think anybody who desires to know more about themselves, just wish for some spiritual enrichment, especially, those of us who are African Americans, like I said, because a lot of this was, has foundings in prehistory. A lot of this stuff predates any written material, and it's ours, and it comes from us. So as far as who should take it, anybody who desires to learn more about themselves, but especially if you're working with young people in any capacity, whether you're a mentor, teacher, principal, counselor, or just a parent, I just think that this is a great guide to help, not only yourself, but, just as best we can pass these down. We can, like I said, we can start to arrest the development in our communities, through this. As far as my journey, through the rights, as a young person, I just like a lot of young Black men, I was in arrested development. I did a lot of things, the hard way. I learned a lot of things the hard way. But short story, I became someone else's parent. So as a father, I had to figure out things, not just for myself, but for my sons. So I went through a journey of transformation. I became a man who worked and strived to become a better man through my children. So I actually got into working with dads. So I was able to go through, and I worked with men who were trying to become better men for their children. Along that journey, I went through, some programs. Public Allies was one. During my Public Allies year, I met, a man who was to become a mentor of mine, Mr. Harpo, who told me about the rites of passage, the Central Rites of Passage. I took the course 15 years ago. It was very, very, very fundamental and grounding and helping me to kind of round out who I am and what kind of person I am. About 6 months ago, I was able to actually kind of bookend, or at least set a new chapter in that journey of going from rites of passage initiate to, I became a facilitator. I actually went through the process again from the perspective of not just learning it, but learning to teach other people. So yeah, it's just been very, very monumental in my own personal self-discovery. And since, like I said, I started a fatherhood movement, Fathers Making Progress, and it's a group, and it's all about us breaking cycles. And personally, like this teaching's one of the most wonderful things about this teaching. If you're talking about breaking cycles, I think the best way to break negative cycles is to instill better cycles. And that's what the rights are about. Just helping you to really, really, really have a foundation to instill, stronger cycles, in for your family and for your community and for yourself. So, I use it with, with the men's group. I'm using it with the men's, we actually have men that are being trained to be mentors to young men, to young fathers, and just to younger men. I also have some intergenerational wellness groups, which basically means we have men that, just kind of wellness, mind, body, and soul, wellness, who they've been together at this point, in some cases like 3-4 years. And, now they're kind of at the stage where they're doing community projects. And one of the community projects that we started over the past couple of years is, we have adopted a high school that's actually adjacent to where we meet over across Lutheran Church, Shalom High School, where we have the young men from Shalom, a lot of them who are just kind of having some tough times. Like anybody knows about Shalom High School, it's a last stop for a lot of kids. Basically it's a high school that a lot of guys come to if they can't get into other schools, or if they've had so much trouble in high school that they've kind of fallen behind. So, we talk about arrested development and folks who need it. These are guys who need it. So we get those young men, and we are taking them through rites of passage classes. Like I said, it's just adapted. It's an adapted version of the curriculum. It doesn't deal as much about spirituality, but we kind of start with the principles of Kwanzaa. This is kind of really creating a baseline, but it's still with the same intentions. Who am I? What's the meaning of my existence? And how do I know this to be true? Just really trying to help establish that foundation for people in their lives. And on a personal note, how this has been helpful during the quarantine? I could harp on how the quarantine has kind of limited some things, but as far as how it's been helpful, I'll tell you this. We talk about blessings. Sister talked about the blessings during this time. One of the real sheer blessings that I've been able to personally derive from my family during this time is I have, like I mentioned, I'm a father. I have living here with me, we have 3 of our children here with me, 3 children here with us that are doing homeschool. In their homeschool lessons, we are incorporating the rights and incorporating these lessons into the lessons that they have planned for the day. So it's interesting how, if this wouldn't have happened, I would have never had the opportunity to do that. Just looking at that as a major silver lining. I mean, you always look to create a foundation in the community, and that starts a lot of times at home with your own children. And this is actually kind of, I have to talk to some of the elders about this, but this is kind of giving me some ideas for some other ways we could possibly move this forward. But I think that the rights in itself, and I'm willing to answer any questions as we go along, but self-discovery and being at peace with yourself and not being at war with yourself. I mean, when you're talking about a quarantine and you're talking about uncertainty in your, outside of your sphere of influence, I just think that that's a great, armor that you can have, spiritually, to protect yourself through these tough times.
Okay, well, thank you, Teron.
Thank you, Mr. Edwards. Next, we have Dr. Patricia McManus talking about Black Health Coalition, the environmental impact of the health of the Black community. Thank you again, Mr. Edwards.
Unit, I think myself there. Certainly looking at the time, I will try to get through, I think, a broader array of things that I was going to say. 15 minutes already was like not a lot of time, but I've enjoyed all the presentations. I've learned a lot. And I always tell folks that people tell me they've learned everything. They scare me.
Yeah.
Always learning, because there's always something to learn. But my topic is environmental hazards. I think I'd like to do it in such a way that might be a little bit intriguing. And so you may want to have me come back on part 2. But I think one of the things about environmental hazards, people automatically think, obviously, of lead. They think of other, things that are in the environment, chemical types of advantage, the air that we breathe. But what some of the writings that have been about, and I didn't have time to pull together my normal research stuff, but I think what's most interesting was the fact of finding and looking at, one, the definition, an environment or an event which has potential to threaten the surrounding natural environment. I think that's important to remember, is that if we're looking at environmental hazards, then obviously we'll think, what is a hazard in that regard? What was most interesting to me was finding that there's an addition now to what's been called a hazard. They give 4 types: chemical, physical, biological, which I think is probably most people are aware of or would think it would be. But when I saw number 4 was psychosocial, it kind of threw me a bit because I hadn't heard that part of it. But then when I saw the definition, I'm like, yeah, that it would fit. And I'm sure there are people who want to fight it. But the definition of psychosocial hazards, this is kind of where I want to put my emphasis, because I think everything else that we know about lead, everything else is there. Also, to back a little bit, I think most people know about the Black Health Coalition, so I didn't want to go to waste the whole time, except that we are celebrating our 32nd year this year, guys. So, hey, I did not, gray hair. My daughter appreciates that because I always blame her for all my gray hair, but I'm like, wow, I didn't expect that 32 years ago when the community said, I get into these things, same kind of thing. Community, Dr. McManus, we want you to do this. Yes, I will do it. Talking about hazards, one of those for you, that you guys know, last year, a year ago, being in the health department, I'm still traumatized. I have not gotten over that yet. But an interesting place to be. But psychosocial, such an interesting piece that now I want to look to see, are they putting this in when they look at what happened, some of the things that everybody's talked about, from Dr. Nguyen all the way up to everybody else, in terms of what does that mean? And the definition that they have is that it's a psychosocial hazards include, but not limited to, stress, violence, and other workplace stressors. It doesn't surprise me they would do work given the whole environment piece, because the environment of work. Work is generally beneficial to mental health and personal well-being. It provides people with structure, purpose, and a sense of identity. Now, when you think about most Black people who have a job in Milwaukee, rarely does it provide the things they talk about here, that it's beneficial. It's usually a pressure. And I can think of every job that I've been through, there's certainly some pressure there just based on being Black and don't be in a position of authority in Milwaukee, or be a professional. They try to debate what that is. I think a lot of times we don't deal with our own trauma, our vicarious trauma. I know this is more Hillary. You can speak more of this than I can, but I think we don't look at ourselves in terms of enough, and even try, which I heard you say, Dr. Man is going to be here. I hope that was, I know that was positive because I know he loves me, so I just fuss at him, But I'm saying that we need to take care of ourselves, and I think that's what I've heard some of that today in terms of, but to look at the fact that now it's beginning to get into the literature, or at least getting to the conversation around the stress. Certainly that whole thing at Coors and everything kind of gives you a sign up in terms of what happens. How much do you think you can take, especially when we work in environments who, if you call something racism, oh, there they go again, everything is. And when you know that how you're treated, what the jobs you get or don't get, even when you're in the jobs, when you give it, you constantly got people trying to undermine your ability to do your job, that kind of stuff, that stuff really impacts our ability to have our own mental health, right? That it's healthy. And I think we don't think enough about that when we're doing the things we do, which sometimes may make us make a decision or stay in too long. And certainly talking to people who are in jobs that they can't get out of. They've got to work. We have some options that other people don't have. And that means something. Then if a person decides to quit, then sometimes we're not sympathetic enough to say, look, you got to keep a job, or what's wrong with you? You quit that job. But they won't talk to you about it because they can tell from the question that you don't understand the environment. I mean, just like they talk about trauma and people say, what happened to you? Rather, they should say that about the jobs too, and the jobs that people work in, in terms of what happened to you at work, so that even the person themselves who don't realize that they've been traumatized many times gives them a chance to talk about, not like, what did you do? But what happened to you? I'm going to leave that kind of thing open because I would like us to have a more in-depth conversation about that, if that's okay. Plus, I don't want to my time is almost up anyway, and everybody knows I talk way too much. So if you let me get into a conversation, we're going to be here a while because I think is so important. I want to spend a little bit more time with it and hope get invited back to spend more time on it.
You'll definitely be invited back, Dr. McManus, but you haven't used your 15 minutes. Did it go that fast?
Yeah, it did. I was looking at it. Well, it didn't go that fast, but I know your time was at 5:15. We're past that. That's what I looked at, was that we're already over time.
You didn't come in at 5. You didn't come in at 5:15. You came in at 5:15.
Right.
So, yeah, we were running a little over, but everybody's conversation has been so good, and I wouldn't want to miss a bit of it. So, yes, we will invite you back, but we don't want to shortchange you today.
Well, no, you're not. I don't feel that way. I'm the only one that can feel that way, right? I don't feel that way because I really do want to spend a bit more time in this research around this so I could bring back more of an in-depth piece, discussion about it. So I'm good with that. Plus, I know we open up to questions. And so I'm good. I'm good. Hey, don't worry about it. Like I said, you can't get rid of me that quick, that easy. So come back again, okay?
We definitely want to do this again, maybe next month. And just zero in on one specific issue or topic that we can address as a community.
Very good. I love listening to it.
Well, there are some questions that are in the chat box, so we want to get to those.
So go to them.
Thank you so much, Dr. McManus. Thank you so much, Dr. McManus, Dr. Wynn, Dr. James, Mr. Teron Edwards. This was truly a fascinating, striking, I don't even know what other adjectives to use, conversation. You have opened my eyes, and I like to think that I read the news a lot, know a lot about the coronavirus, and somewhat abreast of how it's impacting our community. But you professionals have really brought a lot of perspective.
Because I meant to say that and I forgot until you mentioned it. I have really been pushing the county and the city, because if you're aware of it, I mean, I've been trying to get all the data. I'm the data freak. I want to look at data because I take that data and I translate it into information that the community can use. They have not, for some reason, they've lumped the city's data with the county. So they only give us county data. Mm-hmm. And the city's data doesn't coincide with the county data. I just heard maybe it might be changed, but just in case, because I've been really on them about we should be able to have, we're a hot spot, you say that. but we should be able to have, given that, how come we don't have we should have Milwaukee City, Milwaukee data that you can just look at, and not looking at a heat map or looking at some other map on the screen. Just give me the numbers. That's all I want, is just the numbers. So I maybe ask you guys to help me put a little pressure on the county and the city, because there's no rationale. This is a pandemic. It took the city 30 days to put out their first little heat map, which was really weird. And what they put out, I mean, it's a pandemic. You got to know something on a daily basis. Now they're doing that, but we're behind, and they pick and choose what they're going to give and what they're not going to give. So just if you guys help me push these people about, we want as much data as we can get. I will, certainly will.
My response to that is that Milwaukee hasn't been number one, among the number one or the top 5 or 3 most segregated cities since I was a girl, since I was a teenager, preteen, for nothing.
Yes, still is.
And I really appreciate how each one of you really very well illustrated the impact of racism, from diagnosis to, and what we struggled with, what we're up against.
Yes.
So I think every one of you professionals, Dr. James, Dr. Wynn, Brenda Ward, Teron Edwards, Dr. McManus, I think this is a time where we're opening up to questions, comments, and concerns.
First question up here is, are there free community resources for mental health services? Who can address that?
I can. Yes. One is outreach clinic there on Capitol near Port Washington. They're free. And it's income based, but you can get free services. Also, the Bread of Life Church. How come I can't say her name? She's my private doctor. My brain just went freeze. Barbara Horner Eibler. She has a free clinic, and it's in at least mental health. Can't turn you down because you don't. But they will tend to deal. People can go to the Access Clinic for adults to be assessed, and then we also have the psychiatric emergency service called PCS. You can have assessments there if they're at risk to or others. Then there's crisis hotline numbers to call. You could call county. I wish I thought to have that. I apologize. There's crisis numbers to call, and there's also mobile crisis teams that anyone can call. And again, I didn't think to have numbers. My apology. I could send them to Zelda, and she could put it out there for people. So I hopefully answer the question.
Thank you, Dr. Wynn. And so on here, on the chat, there is our website, claw.org on here. Thank you, Zelda. Please join us on Facebook, Center for Leadership of African Women's Wellness. We have a page there where we share vital information, and it's a discussion group, so anything that we have going on, it will be on that Facebook page and our website. And the next one is how that we are at the I think she means now that we are at the reopening. Now that we're at the reopening stage, what should we be doing in post-COVID-19? What preventive measures do we need to continue and prepare a way to wear a mask when coming home, shedding our outerwear or clothing?
Right, I can talk to that. I think one of the things we have to be clear on is that we're not past anything. We're still very deeply in the middle of the current one. One of the main reasons is because the lack of time that we've been able to do the proper testing, because we have to have the proper testing to know automatically cases are going to go up, because we haven't tested the folks to even get a sense from the population what percentage of our population is a case of it. What percentage has no symptoms but they have it? We have a lot of folks who are out there who have no symptoms, but they still can be infectious with no symptoms. And these are the things why we should have had more levels of what should be happening with our community, especially way before now. So we still need to push that in terms of them not recognized, because even though the South Side had as many, they didn't have as many cases, but they were able to test more accurately than we were. But we need to have that done clearly as soon as possible. Also, it's already been projected that that the second round of COVID is going to hit at the same time that the regular flu season hits. So that's going to be an issue, you know, in terms of how they do it, in terms of recognizing what does this mean? Is somebody more susceptible because they're getting hit with the flu? They're not taking the flu shots. Again, you're looking at an age in which I am in, and that we need to make sure that we do that. But they're even talking about a third round, you know, into next year. And so we really need to be aware of what that means, because there's going to be they're already kind of got a fatigue about this thing. You know, the folks who are over it, but they're not in it. You know, I can tell that just by talking to them sometimes, the city or the county, but our folks and us, we are still involved in this in terms of what's going to happen. We could still lose a lot of people. Now they have this piece that's very peculiar to children. Folks kind of thought children under 5 was safe. Most of us probably know that never was, but it just comes out differently. So we need, again, to stay on top of this in our community and not just trust what they're saying at the health department. And, you know, when I was there, y'all gonna call me. I expect people to call and ask questions. They don't. They get real defensive, like you're accusing them of something. And I don't think we can, with the number of kids that we have and families that we have and people, elderly people that we have, we can't worry about they're getting their feelings hurt. This is not about feelings hurt. We need data. And we don't want our data just lumped into the county data. The county hasn't wanted us any other time. You know, why all this? But I think it has to do with some of the deficits that's occurring in the health department. But that's one thing I need to say, just collectively, not just this group, but we need to get more involved and start and pushing them to do right by us.
So the next question is, we address churches. Please give some steps to furthering belief and helping individuals to maintain trust in the current and post situation. Also, where it is possible to find large quantities for churches, prepare congregations with equipment, anxiety and PTSD, etc. What steps do we have to keep youth and adults as we move forward, as well as stress precautions moving forward as each pandemic lasts at least a year or more?
I think we will have to continue to find it more important that we have these kinds of conversations. I would expect that we have more said from the religious communities, which I'm sure they are dialoguing, but we are going to need to see more of these kinds of conversations taking place.
Mm-hmm. The next one is, prayerfully, COVID-19 will go away. How do we prepare for the aftermath of the virus, for the devastation of this virus, medically and mentally, for community services and help for Milwaukee residents?
I would love to see that there be more conversations with the Milwaukee Health Department. Perhaps I'm just not in on that group, but as I see the various presentations being taking place, I have been struck by the absence of the community engaged in conversations with the health department. They are, I would expect to be in their role is to look out for the interests of that community, but I find it difficult to understand how that's done without any participation from that same community.
Well, can I speak?
I think it gets back to the question that Dr. McManus has raised in terms of the challenges in trying to get more of the data that needs to be made available to us. I'd like to know more about who the people were who died in terms of a profile.
And let me just say, question again is that the city and the county, this is a concern I have, is that like most times they talk to the community people who they want to have there. And those are the ones that they pick, like the ones they have board of health, that most of them don't, I mean, they were picked because they were just picked, not necessarily, and I'm not being unfair, I'm just saying I know them all. So this is politics. It's unfortunate that politics is in the middle of it, but that does happen. But I think from the outside, even when I mentioned about before, I think we've been too nice. And we can start demanding that they talk to people that we think they should talk to. And also not treat us as being stupid because we don't have, they said, well, I guess they're treating us stupid when you do have, I got the same credentials most of them have or more, that we do have that. But that's how they just leave us out. And we're too nice. Got to say something.
I wonder too with the death certificate information, because I guess they don't want to release what the other conditions are, the way they're signing the death certificates. But after somebody's died, that's really public, it's in the public domain, just so to speak. So I don't know why they're not releasing more information about the other the disease conditions that were also played a role.
Right, and just also too, whether they died in the hospital or whether they're the ones who had, because they weren't just sending home people who had no symptoms. They were sending home people who had at that time those 3 symptoms, and there were like 10 or 12 now. But those 3 symptoms, they sent them home. And somebody just mentioned about people living alone. Even if that doesn't mean that they may not have a symptom. I put something out saying we need to, if you could know anybody that's living alone, I don't care what age they are, somebody needs to check on them because this thing hits so fast. They know for sure there were, more than a few people who died at home.
Yeah.
Who had been to the hospital or they called in and didn't get in because the system was set up that, well, you have to go to your primary care doctor first. Well, how many of our folks don't have a primary care doctor?
Right.
And then they try how to do that, and that was just more time that's taken away. That's what I'm saying. I think we ought to get together and ask to have a meeting with them folks. Like you're talking about, Janine. I think we should, and it should be with the county people and the city people. Because if it's just the city people, they're going to push back, or if they meet with us, they're not going to say anything. I think the county people really want to do more, but they're being kind of told by the city people, well, this is kind of it. This is all they need. I think that needs to be done. Is to ask that.
What do you think about reaching out to the families themselves? I mean, the family knows and would have the information. So I'm wondering, is it possible to approach it from that route?
Well, if you know who the families are, some names have been in the paper, some haven't.
I thought all of them have been in the paper.
I don't think so, but you might be right. But I didn't think all the names were in the paper based on the numbers they're talking about now. But I'm more interested. But I think we can get that. I think that's a way. You know what? I mean, whatever our strategy should be, it should be multifaceted. It shouldn't be just one way of doing things. I think that's one way we can do it. I'm interested in the data because I just don't need to know that out of 400 people who died in Milwaukee County, that 50% of them were Black, but then how you cross that with the age? How do you cross that with the other? Want to look at that stuff, and they act like, and that's what public health is all about. So it's blowing my mind that or you could go to a heat map or go to another map. Those heat maps are for professional folks. Plus, but that's what I'm saying. I think it really is whether they're doing it on purpose or whether it's just the way they do things. They really are resistant. So I just think the things you're talking about, I think we should have that on there too. If it's not HIPAA violation, we should get that information. If they don't want to look at it, we want to look at it. How can we be?
Right. I was surprised that wasn't being made public, the other comorbid conditions. And because I think it's helpful to know what the symptoms were. And I mean, I guess you'll never really know, was it the coronavirus, was it contributory, or was it not necessarily related? That maybe we'll never have those answers, but just
afraid to look at that. See, I mean, I can look at other stuff that my stuff goes, and Dr. James could look. I mean, that's what I'm thinking, is that we begin to look at stuff, and I really think that like I said, the response I'm getting is not from the county. It's what they've set up in terms of this deal with the city. But I just heard got $103 million straight from the feds. It didn't even go through the state at all, supposedly to address what's happening with.
Who got the money, Dr. McManus?
Yes, what do you say?
I said, who did you say got the money? I was
The
distracted.
City Health Department. They got it, apparently. That's what I was told anyway. And that, so to have them, if they're going to use this money the way they use it.
Yes, it's me. Thank you. You ladies and gentlemen, you've provided a huge a wealth of information, and we have some questions. There's people that have posted comments in the chat. For Patrice Robertson, it says, thank you, panelists, for sharing and this discussion. From Inner 3 Peace, there's a book recommendation from David McBride, One Caring for Equality from TB, tuberculosis to AIDS, History of African Americans, Health and Healthcare. We need to encourage Black doctors to open up clinics in the inner city, we midwives, and pop-up educational support centers. That was from Inner 3 Peace to everyone. And then from Kahina Holmes, there's a question about the testing locations, which I feel is very important that we address. So the testing locations are at Midtown Center, 5825 West Hope Avenue, and it's from 11 in the morning to 8 p.m., Monday through Saturday, closed on Sunday. Again, the Midtown Center, the address is 5823, 5825 West Hope Avenue, and it's from 11 a.m. to 8 p.m., Monday through Saturday, and it's closed on Sunday. On the south side is UMOS. Their address is 2701 South Chase Avenue, and they're also open from 11 in the morning to 8 p.m. at night, Monday through Saturday, and they're closed on Sunday. And I just put this up on our website, which was updated. Today's the 17th. So this is pretty current information. Also, it states that residents can call 211 for any questions or concerns related to COVID-19. Testing is free of charge at both the Midtown Center and the UMO Center, and no appointment is needed. You don't even have to be showing symptoms to take advantage. This free testing began Monday the 11th in Milwaukee. Going back to the chat.
But the community health centers also do testing. They're not the ones by the National Guard, obviously, they have a lot more time. And for Midtown, so that they know where Walmart, it's on the other side of where, if you just ride up where people mostly are Midtown, that they're looking for. I know I looked for it and missed it, but they moved it. So just so they know it's on the other side, on the Walmart side, where there really isn't anything there anymore, that they can go there. But the community health centers, so Market Health Services, Progressive, not just outreach, they all are linking together to provide, but they have a number to call, and then they want you to set up things a little bit more, and they're following more of the CDC guidelines as it has to be, showing symptoms here. And I just went to the one at Midtown yesterday, and they just zip you right through there. But they said that they got like that first week, they had 6,000, total of 6,000 from the sites and everything in terms of people coming. So we certainly need to encourage more people to do that. That's all.
Commented that she wanted to give 2017 statistics. African Americans, 6.2 PhD, 5.6 nurse practitioners, 12.6 social workers, 21.3% psychiatrists are in a minority group, and 3.7 members of the American Psychiatric Association and 1.5 members of the American Psychological Association. Teron Edwards had commented he has a question. Then Lucille Bennett.
Say one comment, Andrea. I'm sorry. That 21%. I just want everybody to see how it is inflated, because they just said in the minority group, and so they could be foreign grad, from other countries that may not have the understanding of like the cultural biases and perspectives.
Okay. Thank you, Dr. Wynn.
Yeah, I did actually. Basically, I'm just trying to think of the way to frame it. I just know in our community has been disproportionately affected, by the COVID-19. Also, one thing that I'm really starting to see, well, I'm starting to see, I saw it from the Jump Street, but we have lots of conspiracies. you know, and I know a lot of it is fueled by mistrust, and a lot of the mistrust is very, very warranted. Mistrust, like the roots of the mistrust. But I guess what I'm struggling with, I mean, there's still populations, even though like I personally know folks who've been affected. I personally know a couple people who died. But there's still, you know, there's still pockets of the population that believe, like you just present some hard data, that believe that this is a hoax of some sort. Like what would you say to that and to them? I guess that is.
Well, I have spoken to people on that subject, and I can't say that it is may not be some of this orchestrated, but the reality is that there are people who have died. There's no question about it. And they have died in ways that have been attributed to the virus. And so I think our primary goal, until this can be disproven, is that we have to survive. And we have to take the measures that we have been made aware of in order to survive. But I don't know how to say whether this is a hoax or not, except to say that there are real people who died.
And I think when people say that too, can you guys hear me?
Yes.
Yeah, I'm just saying, it's, you know, it's not, unfortunately, it's not unfortunate that some people would feel that way, especially depending on what's happened in their lives, you know, that everything kind of is a hoax. So I think rather than trying to get them not to think it's a hoax, let's see if we can make sure we get a system together and they can talk to people who they have some respect or trust in to give them some information, because we're probably never going to be able totally to take that out, but maybe we could take some of it out, a good portion of it out, if we start doing things that our community starts doing, that know that we've got, that we are looking at what's going on. Also take some of them folks and put them on some meetings or something, you know, and have them come and see as well. I think that works with people who you really feel, because those are the ones who've been the most disenfranchised, the most people that many times when people talk like that, it's because of the long strand of their lives being not trusting people and not it happening the way they think it should. So I think we just need to work with them more, certainly not to ignore them.
I was looking at the chat in regards to hotline. Do we have a community hotline that focuses on cultural, a cultural base type of hotline for us to be able to reach out and talk to people? Because each panelist has targeted based on our environment, our community, what our people are feeling. And a lot of times it's sad to say that there are others who don't understand our questions or what we're feeling.
I've had people who have reached out to me based upon their understanding of my interests. For example, someone contacted me because they learned of someone else who attempted to receive testing, and upon that, I contacted that particular institution to make them aware that someone had been turned away and that it was contacted. So I think that you've heard those who are here at this town hall have heard each of us speak. And if they think that there's something that we might be able to assist with, I encourage you to reach out to us. And we do have some ways to get to some of the entities that others may not have, to perhaps move some things along.
Thank you. So go ahead, Doctor.
I think the other thing too is that I didn't want to, I'm not sure exactly when, but I have made the decision to start a Facebook Live chat, you know, that would be through our community, and certainly we probably make sure I attach some type of, with this thing going on, you're not in your office all the time, that's a problem, but trying to get some type of link attached to that so that people can ask questions, and then I would make sure that we tried to find the answer. So that's close. Hopefully that's close to what they're talking about. And it doesn't mean you only can have one. We need probably more than that. But I am hopefully before the end of May, I will have at least had the date set up to do that a couple times a week, where just get on there and talk, let them know what's going on, what I know anyway. So we can at least begin to tell people that we are trying to do it.
Thank you.
Thank you, Dr.
So
McManus.
I have a question for Inner 3-piece.
This is Karen Nelson. I just wanted to say congratulations and what a remarkable job for pulling this forum together, and to encourage you to keep doing this throughout the whole COVID-19 crisis. As my health officer in the city of Appleton said, the Supreme Court vote may have ended the order, but it did not end the pandemic. So it is still with us. And as the old adage went, when white people would get a cold, black people got pneumonia. Well, you know what it is now. That is, when white people get pneumonia, we die. And so I just want to encourage you all for bringing this forward today, and to encourage you to keep this forum going for those of us in the Black community to stay informed.
Thank you.
So I do have, would you please put your information, your contact information, so we can contact?
So, Dr. McManus, I just want to say thank you to everybody. I want all the speakers to know the reason why I got on today, because you were here. So this is really fantastic. And yes, we didn't have a whole lot of time. I'd like to see this continue. But Dr. McManus, my question regarding the hotline was directed to you. One, in general, it would be good for Milwaukee residents to have somewhere to call regarding sites and any myths or conspiracy theories to be debunked. But also, I thought in terms of that data that you were looking for, people could call in and give some of that information, which could lead to research in terms of the numbers that you're looking for as well, or some anecdotes. If the city got that much money, they should have a coronavirus hotline for residents, period. They should pay some money for that hotline.
Mm-hmm. The hotline, because they have a hotline now, but it's pretty much run by just what they have is just to have them hook up to 211 with the them stuff like that. Not that people don't need it, but I think we should have our own. And they have to pay for it, but if they don't, I don't care. If I don't get it, I'm gonna do it anyway. If I don't get any money, I'm doing it because that's what our community needs. But we should force fund something around just like that. But if they don't, like I said, I'm going to do it anyway.
I'll be happy to help in any way. If you need to have some of the volunteers trained in any way, I'll be happy to help in any way that I can. My other question is for Dr. Nguyen, which is, you talked about somatic symptoms, right? And minorities showing more somatic symptoms in terms of the co-occurring diagnosis. And I was just wondering, in terms of that, do you think it's because perhaps they wait too long for mental health interventions and care? And then I have another question about integrated health and mental health.
Our symptoms many times are shadowed by terms of that stress, that environment. So many times the regular practitioners, they ignore what's said and they don't validate it. So then people think, they're doing anything. And so I think that happens a lot. I think that's another piece that we need to do is to make them comfortable that no matter what they say, we can look at it and the goal is to help them, not to make them think that they've done the term crazy. I see it. This is 2020. I sit back, I just watch people are treated sometimes. It hasn't changed very much. So absolutely, I think places that we could maybe hope that some of the clinics would have something that would be much more open, listening to people like we're talking about. Because if it's the health department, they're just going to be great public health answers. They're not saying in some ways because they can get sued for it. I do think that's something else that needs to be in the community. where people may feel, and it doesn't mean folks can agree, because talk to them, and you know, you don't just put down that they say it's a conspiracy because you think it isn't. They're talking to them, at least respecting their opinion. That's what we need to have. We don't have that now.
And then,
Thank you, Janice. Go ahead, Dr. Quinn.
one more question, and that is, knowing that our community, African Americans, have such a distrust of systems, period, but healthcare systems, and rightly so.
Right.
How is it that we have not come together to begin to provide naturopathic and homeopathic alternatives for some of these co-occurring diagnoses, like diabetes and depression, asthma and depression, and because our people need to know that food and vitamins and sleep and exercise can do some of the same things that some of these pharmaceuticals can.
Well, I'm trying to think of how to respond to that. To get that type of treatment known to people will have to come really from those who have that experience and specialization. In other words, it would be difficult for me to speak with great authority about some of that modality when that was not the manner in which I received my training. But there are individuals who have had a great deal of experience with that, and they will need to speak up, or those who have utilized their services will have to speak up and provide for them a forum of discussing just that sort of thing. There was a presentation, in fact, this past weekend, yesterday and today during the same time that they were meeting, and there were some specialists in some of those natural types of treatments, and I'm sure it was of great help. So that information is being circulated. They had that seminar over, as I said, this past weekend.
And I think also that since it's not currently covered by health insurance, then that is also a barrier to utilizing a lot of those services also. But hopefully that will change.
A lot of stuff is covered now, like yoga classes and mindfulness. That's covered by Medicaid now. You would be surprised how much stuff has been updated regarding Medicaid and Medicare. Like, for instance, Medicare will pay for silver sneakers, which is exercise at the Y. So you would be surprised.
414-257-7665. She also posted about the psychiatric crisis line, 414-257-7222. And this is all on the Center for Leadership of African Women's Wellness website. The Center for Leadership of African Women's website. Dr. Wynn also posted the address of the Psychiatric Crisis Service at Admission and Watertown Plank Road, the NAMI, the National Association of Mental Illness Helpline, Pathfinders, Walker's Point Youth Family Center, and the Warm Line, which is a peer-run support group that we as clinicians, I know Brenda has used that with her clients, where she's encouraged clients to contact Warm Line. So again, that's all on the Center for Leadership of African Women's Wellness. Also, the acronym is CLAW. Dr. Wynn also posted about the Milwaukee County Children's Mobile Crisis Line, the Mental Health Crisis Line for adults, because the Milwaukee County Children's Mobile Crisis for Children, sorry, of course, and then the Teen Crisis Line for ages 11 to 17. Again, it's all on the Center for Leadership of African Women's Wellness website. Ms. Ward,
Our social worker posted the number for suicide prevention lifeline number, 1-800-273-8255. There's a comment from SY thanking us for the presentation. And then Karen Nelson posted her address.
It was so wonderful for each and every one of you to attend, and we appreciate your participation. And we got a lot of information, and we're going to work on this again
Yeah.
really, really soon to
And
bring it
Dr.
all back
I
together.
just want to add, if you haven't, then please join the Center for Leadership African Women's Wellness Facebook group page. Then we will update posts on there, and you can get information and follow us.
Okay.
Also, we, if I may, we also, Claude would like to invite anyone to help us volunteer, become a member, express your interest in how you would like to participate and support us. After you go on our website, also Facebook, we're always looking for people to work with and partner.
Thank you so much. I just want to thank all of our presenters, Dr. Janine James, your topic of restoring our health in times like these. Dr. Nguyen, presentation, the state of our community. Both ladies, impressive, fascinating presentation. And then Ms. Ward, social worker, our social worker, state of our community's mental health. Another powerful presentation. I want to thank Teron Edwards, who spoke on the rites of passage, a process of transformation and self-discovery. And of course, Dr. Patricia McManus, the Black Health Coalition, the environmental impact of the Black community. Thank you so much for all of our participants, all of our presenters, everyone who commented on the chat website. Again, our website is Center for Leadership of African Women's Wellness. Thank you for all who commented. Dr. Pruitt, thank you so much. This has been a wonderful and powerful presentation, and I hope that you continue to follow us on our website, the Center for Leadership of African Women's Wellness. And African is spelled A-F-R-I-K-A-N. Thank you so much.
Thank you, everybody.
Thank you, everyone.
Thank you.
Bye.
Bye-bye.